In the meantime, the White House saying they're seeing a surge in traffic at healthcare.gov. In fact, that website for a time was down today. It says more than 6 million Americans have signed up. By the end of today, will the administration hit its original goal of 7 million enrollees? My next guest says these numbers are meaningless. He went further than that. Republican John Barrasso chairs the Senate Republican Policy Committee, is also a doctor by trade out of Wyoming. How are you, sir, and good morning to you.
Thanks for having me, Bill.
Do you expect the headline before midnight tonight or even tomorrow morning that the White House says we hit 7 million?
Well, they're going to try to talk a big headline for tomorrow, but the reality is they're not going to have that many people who actually have insurance. To me, they're hiding the ball on this. They won't tell you how many people have actually paid for the insurance, and we know in states that follow this closely, in a number of those states, fewer than 6 in 10 who sign up actually pay for the insurance. They also won't tell you how many of these folks were just part of the 5 million who were canceled from their policies and are just now trying to get insurance back, as opposed to people that are really getting insurance for the first time. And finally, they're not going to tell you how many of these are the young, healthy people who are going to be forced to buy insurance that they don't need, don't want, and will likely not use. And that percentage has to be pretty big for the whole system to work.
I get. Now listen, just break that down. If you don't know the number of young people, if you don't know how many who were uninsured previously, and on and on and on your list there, why is that significant to the law? Why does all that matter?
Well, otherwise there's going to be an incredible effort to have to bail out the insurance companies, because if only older, sicker people sign up and not enough young, healthy people sign up, then the math of it doesn't work. The arithmetic falls apart, and then the government is going to end up bailing out the insurance companies. Plus, the insurance companies for next year are going to have to raise their rates tremendously. They're already looking at a double-digit price increase for next year.
Okay, you said on Fox News Sunday you've looked at this 10 different ways. And you told Chris Wallace this health care law is unfixable. Now, the White House would argue they've already crossed the Rubicon on that. They're back into the safe zone. You know, the death spiral that everybody feared around the first of the year did not happen. Does that mean Obamacare is here to stay, Senator?
Well, no, I don't believe it is here to stay. There are a number of Democrats. 6 senators have brought forth a bill which they call is a fix to the president's health care law. To me, let's not be fooled here. All they're doing is nibbling around the edges. Those who are up for election this year, they are unnerved. They're pushing the panic button, trying to find some solutions. But people all across the country are bothered because their policies have been canceled. They can't keep their doctors, can't keep their hospitals, especially when they sign up for the president's health care law. And they're seeing that they're paying a lot more now for coverage that they don't necessarily want than they were paying for before for coverage that worked best for them.
Your sparring partner was Angus King. He's an independent senator from Maine. This is what he says is happening on the inside, on the signups. Listen.
The president of WellPoint, which is one of the big national insurance companies, said a couple of weeks ago that the signups are getting younger by the day. In other words, younger people, not surprisingly, are the last people to sign up. I suspect that's who's signing up today and tomorrow.
So is that true, or does he just suspect that? And the administration had said for a long time the young people, they're the last to do it. So would you accept, or is it possible that they are getting this late-minute surge here? Go.
Well, they may be having a late-minute surge, but they are woefully behind the numbers that even Kathleen Sebelius said they needed to when she said they needed 40% of those signing up had to be these younger, healthier group. The insurance companies also say the White House has the numbers about how many people have paid, and that's why I say the White House is cooking the books, because they're not being open, they're not being transparent. They won't tell the American people the numbers of how many people actually have insurance versus the number that just visited the website.
So you're saying, given all the technology, you know the numbers every day?
The numbers are there. The White House refuses to come clean with the American people.
And when do we see them, sir?
Well, if they're not what the White House wants them to be, we may never see them.
Ever?
Well, they have the numbers now. They've decided not to give them out. So The American people are going to keep asking for these numbers to find out if this is working or not, but individuals are making their own decisions on this. 2 to 1, more people believe they are hurt by the health care law than were helped by the health care law, and that's why the last week's poll, only 26% of Americans support the president's health care law.
That's very intriguing. You say that we will never see these numbers. I mean, how is that even possible?
Well, part of it is, I think that the website, the national website, they left off the question about were you insured beforehand or not. So in some ways, and Kathleen Sebelius has even testified, we're not collecting the information, even though the president said his goal was to take 30 million uninsured Americans and get them insured. The administration is now saying we have no way to find out how many of the people that have signed up didn't have insurance beforehand versus were canceled because of the law itself.
Thank you for your time, sir. You made a lot of strong statements yesterday morning. We wanted to get you to react on that again today. You say some of the best cancer hospitals in the world don't want to be anywhere near these exchanges. We'll see whether or not that's the reality very soon. Senator, thank you.
And children's hospitals as well. Cancer hospitals and children's hospitals.
If that's true, I mean, that's another major headline. We'll see if it is. John Barrasso, thank you for your time from the Hill today in Washington.
Thank you.
All right.